Assalamu alaikum doctors. In this video, I'm discussing how can we take the brain tumors history. So brain tumor, the chief complaints, how can it come on exam? There are four scenario I'm sharing. Scenario one is like that: child 2 years old had recurrent vomiting and irritability. Second scenario is that child is 8 years old, came with the vomiting, headache, weight loss, loss of appetite, and not being himself. So vomiting, headache, weight loss, loss of appetite, and not being himself. Scenario 3, it comes like 13-year-old boy and his mom. Task was that this boy has come to discuss a lump in his chest. Okay. On question is the lump was removed last year and he had neurofibromatosis type 1, also had a neurofibroma close to his optic nerve, was being watched for scoliosis. He had developed pubic hairs age 7 and been on treatment to delay puberty. So one is like neurofibromatosis and brain tumor mixing coming. Scenario if another history comes like that: persistent headache in a 14 years old boy. Headache did not sound typical of raised intracranial pressures, but she did have a new squint for which she was being treated. Last CT was 3 months ago. Another scenario 5 is that 6 years old boy with headache in the last 6 weeks, and the child had recurrent attack every 6 months for the last 2 years. Family history of migraine. So these are the headache, vomiting, new personality changes, squint, vomiting. These are the features of brain tumor and come the chief complaints. So first of all, we ask chief complaints, the clinical feature we analyzing. Ask if they started together or one by one. Then start with the serious one. Okay. First onset, course and durations, what make it better and what make it worse. Then the headaches explanation, we know that Socrates. Socrates is the site. Is it all over the head, forehead, or at the sides? Severity. If I give you a score of 0 to 10, 0 is the lowest and 10 is the highest, how can he feel the headache? Number 3, onset. When started? Character. Is it pressure like or bending like? Radiation. Radiate to any other side. Then association. Is it associated with vomiting, nausea, blurring of vision, hearing, and some voices? Now about the timing. Mainly in the morning or same all over the day. So mainly morning vomiting with headache, we know that the warning sign. And what relieves the headache? If with vomiting, then the brain tumor. Is it headache awakened from his sleep? Also brain tumor. So these are, we understand that headache is with vomiting and morning vomiting, and it awakening from the sleep, it is brain tumor. Now about the vomiting, we explain like onset, course and duration, what make it better and what make it worse. Then is it coming easy or need effort? Is it mainly in the morning? Is it forceful? Weight loss, we ask that how did you know that from his clothes or growth chart? Did you have his growth chart? Did you seek medical help? Then loss of appetite, we ask like describe it for me. How many meals? Content of each meal. Is he preferring certain type of food? Any psychological issue? So these are we asking. Then we are going not being himself. If the chief complaint is not being himself, then is in the form of what? Did he lose interest in something that was enjoyable for him before? Any abnormal behavior, any abnormal movement, any psychological event happened before this complaint? Any suicidal attempt? Then squint. When started? Sudden or gradual? Which eye? Affected of visions? Any eye redness? Direction of the squint? Sign of any increased intracranial pressure and preceded by trauma. So squint is when started, sudden or gradual. Which eye? Affection of visions. Any eye redness? Direction of the squint? Sign of increased intracranial pressure and preceded by trauma. Then FWASL activity, fever, weight, activity, sleep. Then any other concern, any chronic condition or long-term medical conditions. Systemic review, we are asking like from CNS. If not the main complaint, sign of increased ICT signs, abnormal movement, abnormal gait, fits, analyze if present. Then any numbness, previous work, vision concern. Then any change in the eye shape of the movement. Hearing concern and speech, behavioral and mood changes, irritability and facial asymmetry. Then from the GIT, increase the tummy size, tummy pain, throwing up, especially morning. Describe for me his poo, yellowish discoloration of the eyes. Okay. Then about the chest, recurrent bug, cough, how many pillows using during sleep. CVS about the awareness of the heartbeats, exercise intolerance, chest pain, fainting attacks, blood pressure, that is Cushing tried, white pulse pressure, bradycardia and irregular respiration. After that, urinary, the P constant, amount, color, frequency, burning sensation. MSK about the skin spots, caffeolate, any patches present or not. Very important, describe them. Lumps, swollen glands, neck swelling, hair, nail, bone pain, joint pain, and deviation of the backbone. Endocrine about the hot or cold intolerance, thyroid, blood glucose measured. Hematology, pallor, recurrent bugs, bleeding and bruising. Past history 5T IOA and it is in details. Head trauma, exposure to radiation, drugs. The previous condition when discovered by whom, how it was presented, is he admitted to hospital in normal ward or ICU, for how long, why they did for what they did for him, how long he stayed, after discharge any medicine was given to him, did you follow with any team. Then puberty shown signs to be a young man even it before its usual age, precocious puberty, parental history if relevant, allergy, then vaccination, missing any shots, any extra shots in cases previously known to be immunodeficient, live attenuated vaccine are contraindicated. The development, does he look like his peers in way of walking and talking, missed any acquired skills. Then family dynamics, consanguinity, how many children, history of similar conditions, history of deaths in the family, history of smoking or illicit drug abuse in the family. Then the social and financial, what did you do for living, is it satisfied for you, did you have any easy access to hospital, who take care of the other kids when you go to the hospital with, do you have insurance, receive any support. Social, school about the delayed school performance, loss of skills, important, any delayed school performance, loss of skills, then you have impact this condition. So this is about how can we take the brain tumor history. And the GD what we keep, these are first of all brain tumor, brain hemorrhage, brain infection and drug abuse. So again, brain tumor, brain infection, brain tumor, brain infection, brain hemorrhage and drug abuse. This is how can we take the brain tumor history. Thank you.